Welcome and welcome to our session. My name is Francesca Quartarulli. I am the Digital Project Manager for mHabitat. So today's webinar will look at creating an open ecosystem for citizen access to health and care, exploring the idea of open ecosystems in digital health. In other words, where we join forces and connect up our knowledge and resources. Now, it might sound simple on the surface, but there are loads of complexities, not least interoperability, commissioning, barriers, which make it quite difficult to realize this ambition at times. But if anyone can find a way through these, to these challenges, will be Victoria and her collaborators at this event today. So thanks everyone. Just a few words around why mHabitat is really interested in this topic. So the conversation around people and relationships to improve systems, accessibility and inclusion are amongst our values. And these drives all we do and all our work. Plus, of course, we won't say no to Victoria, who is mHabitat's founder and our ex-boss. So welcome, Victoria. It's really good to see you.
Thank you very much, and thank you for the invite to run this session, and thank you very much to everyone who's joining us for the next hour or so. Really appreciate you coming along. So as Fran said, the purpose of this session is to share through a case study approach some learning about how we might support digital access at a region-wide level for citizens to health and care services. So I've got a brilliant group of panellists who I'm going to ask to introduce themselves in a minute, and we're going to talk about a project we've all been collaborating on in the Cheshire and Merseyside region. But before we get into talking about that, I would really encourage you to have conversations in the chat, ask questions, and I'll keep an eye on the questions and lob them in as we go. But before that, we'll just do some brief introductions. And I'm going to ask everybody to start with a fun fact about themselves, just to warm us up. So my name's Victoria Betton, as Fran said, from the Mindwave team. And I'm going to be chairing the session today. In terms of a fun fact about myself, this isn't fun, but it is a very depressing fact, which is that I just cannot keep anything green alive, which Roz, who I know is watching from the mHabitat team, will be very horrified about as a very green-fingered person. I've just moved flat, and as I look around me, I've got tons of plants that I've bought to make my flat look lovely, and they will all be dead by the end of the month. So there you go, that's my fun fact. Jim, I'd like to invite you to introduce yourself, say a bit about your role, the organisation, and tell us something that people wouldn't know about you from your role.
So, hi. So I'm a strategic advisor working for Mersey Care and North West Boroughs, who are their mental health trusts mental health and community trusts in Cheshire and Merseyside, and within that role, I also lead on regional digital programs, particularly the personal health record, but also the expansion of regional telehealth, and also the delivery of integrated data for population health for COVID purposes is what I'm doing at the moment. So that's my role. You want a fun fact about me? Did you want a fun fact about me and my role, or just a fun fact? I'll give you a fun fact. I'll give you a fun
Whatever
fact.
you want, Jim.
Sure. So I'm an identical twin, but this is definitely me. And up until about the age of 4, my twin and I, and his name is Aidan, we used to have our own language. All of which I forgot. And what I normally say at that point, it was Italian, but it wasn't. We had our own language that was completely not another language. So there you are, as a fun fact.
Yeah, that's an amazing fun fact. And
Yeah.
everyone's struggling now as to whether they can match it in any way whatsoever. Absolutely.
Well, there we are.
We could have a whole webinar just on that subject.
We could. I could talk about twins forever. Yeah.
Thank you, Jim. And for the purposes of this webinar, Jim's obviously acting as, well, is the client for this piece of work. So I'll invite Jim in a bit to tell us the problem he was trying to solve when putting together this project. But Kumar, can I invite you as founder and executive director of Mindwave, just introduce yourself and a little bit about who you are and a fun fact.
Hi, thanks so much, Victoria, and I'm not going to be able to follow Jim. So as you say, I founded Mindwave about 5 years ago, and Mindwave is a digital company, and I will talk more about the company and what we do a little later. We are a team of around 60 now, working in the digital health field. Fun fact, yeah, I think anybody who knows me knows that I'm not exactly, even through lockdown, exercising or doing anything. I think I go up and down the stairs and I look at my step count, it's abysmal. If I reach 1,000 a day, that's a lot. Nevertheless, at one time, when I was very, very young, I actually held the record for 100 meters for the whole of Eastern Sri Lanka. So,
wow.
School time Eastern Province champion in 100 meters.
Well, how the mighty have fallen, Kumar.
Oh,
we'll have to be nagging you about your step count now. Thank you very much, Kumar. Liz, would you like to introduce yourself?
Yeah, thank you, Victoria. So my name is Liz Ashall-Payne and I'm the Chief Exec at ORCHA. I started out my career as an NHS healthcare professional working in speech and language therapy, Jim. So really interested in those language stories. We'll take those offline at some point. And I worked in the NHS for around about 20 years, got really interested in system transformation, and then worked across Europe and got really interested in the opportunities that digital health brought, and then founded ORCHA 5 years ago. My fun fact, I was thinking, well, if you looked me up on LinkedIn, you'd see that career. But the one part of my career that you wouldn't see is that I used to manage a professional boxer. And there's a whole nother story to that.
Okay, right, okay. Well,
interesting
that's
times.
Another one for another webinar. Thank you so much, Liz. Thank you. Lloyd, would you like to introduce yourself now, please?
Sure. So I'm Lloyd Humphreys. I'm the head of Europe for Silvercloud, a digital mental health platform, but by training a clinical psychologist. So worked in the NHS many years ago, where I set up one of the first refugees and asylum seeker services within Salford, working with torture survivors and non-English speakers. Went into kind of technology about 15 years ago, helped co-found the first online treatment for a program for addictions, and I've been with Silvercloud for the last 2 years, where I lead the organization across Europe. So, fun fact about me. Right, okay, so I will try and bring in a bit of Kumar and a bit of Liz. So in 10 days' time, I'm about to run the virtual London Marathon, my first London Marathon. So I am now kind of in that kind of panicking phase where I don't know whether I'm fit enough. And I used to be a semi-professional speed skater when I was younger.
Wow, there's a sports theme developing here, and I'm feeling very ashamed now because I decided not to do the virtual marathon. I'm waiting for the actual real life marathon, so good luck. I hope that goes well. Okay, what a brilliant panel we've got, and we're going to be able to give you a really rounded case study about creating a citizen front door to health and care services. And never, I guess, has the role of digital been more important with the pandemic and the impacts in terms of contagion and the need to socially distance. So never has this been a more important topic, but also never more has it been such a fraught topic, particularly when we're thinking about equitable access, making sure we don't leave people behind. And as Fran said, getting all those system partners working together so that we create digital services that are coherent, accessible, beautifully designed and easy to understand for citizens. So that's the broad sort of scope of our conversation. And what I'd like to do now is to invite Jim just to talk a little bit about the context and why you decided to set this project up and what problem or set of problems you were trying to solve, Jim. So if you could just give us some of that contextual information, I think that would be really helpful.
Yeah, sure. So the program started probably about two and a bit years ago, emerging from a regional digital strategy in which had crept the word empowerment, and it was decided we'd do something about empowerment. And it's, I suppose, in broad terms, it was about how people got access to digital services. But in truth, the way that people thought about it, predominantly, say my colleagues, was about how we did things for people so that they got stuff. And I suppose I had a very different view of this, which is actually that isn't empowerment, because that is the power still stays with the people who were in organizations. And actual empowerment is about how do we respond to the needs of the public and individuals so that they get access to the services that they want, not those that are delivered to them. I don't think I was a lone voice, but it wasn't, I wasn't properly understood. I think through all of this COVID stuff, I think people have now a much better understanding of what empowerment is all about. But nevertheless, so the issue that we had within Cheshire and Merseyside, or the challenge that we faced, was that a lot of trusts said, oh, we need a portal. And a lot of them, a number of clinical groups were saying, and we need to be able to give people access to an app. And for every ology there was an app, and for every service there was an app, and they weren't always the same. And the recognized issue was that whilst organizations, despite the fact they work within regions, consider themselves to be both individual and to some extent special and unique, they reckon, well, if we do a portal, that'll be the Trust A portal. I won't mention specific organizations, but you might be able to work out who I'm talking about. But Trust A will have a portal, then Trust B, then Trust C, Trust, and you could go through the whole lot. And then each local authority might have a portal. And this then becomes confusing for the individual whom we're essentially trying to empower, because what they actually want, and this was confirmed through the discovery work we did when we engaged Mindwave, was actually what people want is a simple way into this, like one way into this, and they don't have to repeat stuff a million times, and they don't want to have to remember, in order to get into, for example, the NHS, they don't have to remember 4 or 5 different ways of getting into the NHS, 4 or 5 different apps that they're supposed to use, and sometimes conflicting in terms of which apps they use, plus all the consumer apps that they may use personally for their monitoring of their own health. So that was the problem area, and I suppose this isn't my phrase, but I use it as if it were, about the. We talk about the digital landscape, and I suppose what we were looking at in terms of portals and apps was a digital landfill rather than a digital landscape. You can see why I nicked the phrase, really. So, what we had to develop was some way around that, and also some way that we could give people access to navigate initially, but also to be able to give them access to their own clinical records, because those clinical records are theirs, they're not the GPs, the trusts, the whatever. And also to recognize that those things that people that data that people contribute to their own health is a much more valuable resource if everyone was contributing, if we were able to store it and use it, a much more valuable resource than a whole heap of coded clinical data, and it was self-generated. So that part of it is the notion of the, could that be stored in some way in terms of a personal health record? So I suppose that's the that's the thing behind it. And we'd initiated an architecture where we had a single integrated platform. We were then hit by COVID, and so at that time we took the platform and just repurposed it for the purpose of for COVID at that time, and enabled access through the region to a portal which gave people access to psychological therapies through which they could self-refer through Silver Cloud, and also a way that they could start to manage specifically COVID help apps through ORCHA. So they're like the sort of COVID response team that I'm looking at now, and very grateful to each of the people, each of them, as I look at the faces. So what does that architecture now look like? And I won't describe it in huge technical detail. Apologies if some of that creeps in, but the idea is that we have that through Mindwave we develop an integration platform, a single for Cheshire and Merseyside with an NHS login. Through that platform, we enable people perhaps to mechanisms to control to have monitor their own health, but also a mechanism to get access to the clinical record, which you can do through health information exchange of records, and a mechanism where we can store their personal health record. And then underneath that integrated platform is the dreaded word ecosystem, but it is a managed ecosystem of that somebody comes in through a single digital front door and gets access to. We pass on the NHS login credentials, and it means that people can get access to, for a particular condition or within a particular organization, either a system or another platform or an app to manage their various conditions. And through ORCHA, that is the mechanism through which we organize the management of that ecosystem. And through Mindwave, it's the mechanism by which we integrate those apps so that they become interoperable. So you're not entering the same, if you have gestational diabetes, you're not entering it into your maternity app and entering it into your diabetes app. That all gets fed back to your personal health record and then pulled off the personal health record so that you can see that if you've entered that data somewhere before, this is now your data that is being represented through the app. So it's easing the burden for the person to come in terms of saying, we have a single digital entry and all of my data is stored in a single place. And I have access to this digital ecosystem. And for our clinicians who can join that portal, they are now looking as a group as saying, well, what is the app that we collectively could think of as being the app for, say, diabetes? And it sits within that ecosystem. We could treat it as a standalone app, but we know it sits within that ecosystem. And we know if somebody needs to do other things with their records, they can do it within that ecosystem as well. So that's the architecture for it. And we link this now going forward. I'm nearly done. Just going for, I think you said 5 minutes, I've done a bit more. Linking it to things like how we support self-care through telehealth, how we support patient-initiated follow-up, how we give people access to digitized letters and appointments through that portal, and a number of other different possibilities. So that's the short form.
Thank you so much, Jim. So I took away two sort of strong themes there, really. One was around that underpinning philosophy of empowerment, around citizens having access to their information, generating their own information, and also this very fractured health and care landscape we have, but also a fractured and dispersed digital ecosystem, if you like, or landscape. And really what you were trying to do is create, or are doing, is creating a coherent, trusted, safe, secure front door for citizens, where the data moves around in the right ways, that mean that people don't have to keep reproducing and adding in new data. And presumably it's that ecosystem that then can grow and develop over time as well.
Absolutely, yes, yes, and it's about a plurality of suppliers. So it's not about saying this is how you do stuff. It's about giving people the option to do what they need to do, and enabling clinicians to to kind of curate whatever the appropriate apps are for the conditions that they collectively may manage. Yeah.
So that sort of vision, we will all know from any of us that work in the digital health sphere, is an amazing vision, but actually quite a hard one to land and coordinate, because you've got so many different moving parts, so many parties in that system. So what I'd like to do now is invite each of the three companies who are involved to talk about a bit about their company and their involvement, so that we understand their bits within it. And I'm going to start with Kumar. So Mindwave are sort of the lead in terms of helping architect this ecosystem and work with others. So Kumar, could you just say a little bit about Mindwave and about Mindwave's role in this and what we've brought to this project, please?
Thank you, Victoria. Yes. So once Jim had this vision as to what he wants to do, we came along, or were brought along by Jim, to make it happen. So we worked with Jim's team to design and develop this ecosystem. So the integration layer being the sort of primary part, but also working with people like Liz and Lloyd and others to create the ecosystem. But the technical part, primary, was putting the user at the center of it. As Jim said, it is what would the people want to do? How do they want to come in, and how do they want to engage? So the big piece of work we did last year was that discovery piece, trying to understand what is it that the people of Cheshire and Merseyside really wanted from a digital offering. And then, of course, other than the actual designs and development, which we do, coordinating all the partners who are going to be coming along to the first part, working with Liz's team, both in terms of app selection, but also we will be working with Liz's team in terms of the criteria for people be on the basis of gatekeepers. It will be on the basis of open entry, but some standards to be met. And the standards will be not only governance and security standards, but also very much, because ORCHA and us are very, very keen on it, is what will the user get? What will be the benefit for them? How will their actual user experience be? I think at this stage, just a little bit more about Mindwave. I started Mindwave, but my tech background is computer games, and that's what I wanted to bring in terms of not gamification, but in games you make what people want to play, and you need to therefore understand what people want to play. So, for example, I still have a bit of interest in game development, and we 2 weeks ago released a game in Snapchat, and I'm assuming those on the screen are not Snapchat users and won't be playing my game. It's a singing game using Bitmojis, if you're interested. But one of the facts is that those who use Snapchat have initial attention span of 8 to 12 seconds. So if I want to actually grab them, that's all the time we have digitally to actually get that age group engaged. And I think it is still a struggle, but one of the struggles is that health apps often did not think in terms of engagement and attrition and all of those things, which were bread and butter for game developers. Because for us, it is bringing them in. Okay, it was commercial. We need them to play so that they pay. But in healthcare, if we want to help people in, we need to engage them, bring them in. Hence, Mindwave as a sort of design, user-led design, and from there we went on to bring together a development team, and our development team are currently still growing, but based in South India, and our design and project management team are here in UK. So we started out on the whole thing around personal health records in South London with a mental health trust in South London and Maudsley. But one of the things that we decided to do was to make it open source. And we have, as a company, always been very keen on open source, open systems, which is where we were able to completely and utterly join up with Jim and Jim's philosophy of what he wanted to see. Of course, as a commercial organization, it's very tempting for us to come and say, yeah, we can do everything you want and it's our system. And that's not works. So we have been much more open about how we do the whole system, the architecture, the data standards, open in all of those ways, but also open to collaboration. So we have worked quite a lot with Liz's team in various things. We have worked with others who the market will perceive as our competitors. But it's always possible to work together and compete in other ways. That's how the world should be. And that is how we have worked. So an important part, I know we'll talk about challenges later, important part of why the relationship has worked with Cheshire and Merseyside was to get the values right with Jim and his team. So we have always had that goal of what we want to achieve in terms of the citizens of Cheshire and Merseyside, but also how we wanted to do it. That sense of openness, that sense of collaboration, that sense of it can keep moving as times change, and we don't know what's going to come in 2 to 3 years. So that we are not locked into some Mindwave system that nobody can break into. And that's how we have got to where we are.
Thank you, Kumar. I just wonder whether you could pick up on a question, which is, you talked about the design team, but how we went about that first stage discovery and then user testing as we've developed the product to make sure that we're making something that's accessible and user friendly. And then could you then just briefly describe, because we haven't got an image of it, but just describe some of the key features of Amity. It's called Amity, of Amity as well, so that people just get a sense of what it actually is.
Yeah. Thank you, Victoria. Yes, in terms of discovery, we talk to our design team, who are, as it happens, based in London and Liverpool, worked with people who are either currently patients or could be patients of NHS organizations within Cheshire and Merseyside. So we talked to a group of people, had workshops with groups of individuals or 1 or 2 people, and from that gathered up the stories, user stories of what they feel about, what they understand, what they perceive of the NHS and the organizations and their experiences, and then as to what they would like from a digital experience. From that, we created, I believe, 9 personas, which sort of encapsulated the stories of what could happen, of varying types of conditions they had or different organizations they would go to, both acute, mental health, and community. And from that, we created a report, which actually was the cornerstone of how the design went. The designs are very much around what we talked about. It needs to be very accessible, both in terms of standards. So all the accessibility standards that one ought to meet, we always meet AA standards, but also that people actually want to engage with it and come on. It's not just a functional thing. It is something that should look good, feel good, and also easy to get to. And what we have now developed, which will be coming out before the end of the year, will also include a huge level of personalization. Not as much as we can have in future, but to be able to understand what we can. So we, for example, have rather than fill in a form, it's questions and answers, gives us a whole bunch of information about the individual, which they can choose to do when they sign up. And the answers from there, we feed into the filtering system on ORCHA. And that's how we filter the apps for them. So people don't have to go and actually type in the filtering on ORCHA. We ask a bunch of questions, so that actually changes the experience they have. It's very digital, very much the case. And again, working with another organization, we can bring all of that together. So it is very much keeping the individual at the center.
Thank you, Kumar. And I guess the other things just to add is that the platform will enable people to see appointments, message clinicians, create a circle of care. So all of their data, but then also we'll move on to access digital services and so on as well.
Correct. Yes, it has 4 sections. So the health section will have the things that you mentioned about appointments, letters, and so on, and also their diagnosis and information pertaining to their health. Then trackers, and the individual will have choice of what they keep open, what they don't keep open. And as Jim mentioned before, if you already have that app, that you could probably just use that and 1 or 2 others. It's not laid out and architectured that you have to use everything.
Yeah.
It can change as your conditions change. So you might be focusing on blood pressure, but you've got that sorted. You might move on to something else. And it's architectured in such a way that it's very much what you do as an individual. And very, very importantly, understanding that your health care doesn't come only from NHS. It comes from your friends and family. It comes from other organizations, voluntary sector organizations, and of course, primarily yourself. So everything is geared towards creating a circle of care, clinicians, other carers, friends and family, but also sharing your data so they can help you, but also the data that you can help yourself or others to prompt you to help yourself. It's all of those things.
Thank you, Kumar. And we've had a question about carers, so I think you've answered that really, but this sort of circle of care where you can give granular consents to certain bits of your record and revoke them very easily is a really important feature of the platform.
Very much so, and it is controlled. The control as a user will be with me, but if I feel that Lloyd actually is the best person to help with my running, I can share my data on running and walking with Lloyd. And if my drinking side is better with Jim, I can share my drinking history with Jim, and hopefully he'll help me drink less.
Okay, thank you so much, Kumar. Now listen, I'm going to move on to Liz to talk about ORCHA's role within this project. Before I do that though, can I just encourage people to have a little look at the chat? So Raz has asked if people would like to introduce themselves, say a little bit about their interest, as well as sharing our learning and our insights. It's really nice if people can sort of just share a little bit about their interest, maybe some work they're doing, and you can share a bit of learning between yourselves on the chat at the same time. So I'd encourage you to respond to Raz while we're having the conversation. So Liz, tell us a little bit for people that don't know, and I can't believe there are many people that don't, but tell us a bit about ORCHA and about your role within the within this project.
Yeah, thank you, and thank you, Kumar, because I think you did a great job already of explaining where we sit. So for those of you who don't know ORCHA, ORCHA actually stands for the Organisation for the Review of Care and Health Apps. However, really important to note here, our mission is not to review digital health solutions. Our mission is to get great quality digital health solutions to people who need them. And reviewing and approving and applying standards is the first step on achieving that empowerment mission that we're clearly also aligned on. So the part of the jigsaw puzzle that we bring, and that's how I see this, it's a true collaboration. We all have a little bit of the jigsaw puzzle, and hopefully we're starting to show the picture, is in order to know which products you need to get to people, you need to ensure first and foremost that they're safe and high quality. And to Kumar's point, know which products are best fit for which people. And that's a layer of granularity that we go through as ORCHA. And one of the things that we do and we're most well known for is that review process. Now, the review process that we take products through is one that is repeatable. And this is really important in an ecosystem like this. It's not just, is that product safe today? It's, is it safe tomorrow? And as Jim said, what new products are entering the market that we can now offer to the population? So our part of this work starts with that review process. And as Kumar and Jim talked about, what we're doing is working within that ecosystem, within the whole stakeholder groups, to really understand what does good look like as a foundation, and then what does good look like for the populations and healthcare professionals within a Cheshire and Merseyside ecosystem. And what we're doing is we're building up an enhanced review component, which is specific for Cheshire and Merseyside and the needs of Cheshire and Merseyside. And this is really important for the innovators, because now they know what they need to do. You know, the rules, so to speak, are really confusing. So we're trying to strip out that confusion so that we can grow this ecosystem. And then, as Kumar said, the fantastic part of this collaboration is at the front end, the person puts in their information, and then together we can use that information to connect them to the right solution for their personal needs and preferences. And this is really important. As Jim said, it's not just about one product that will meet everybody's needs. That will never happen. In fact, even on an individual basis. So I'll use me as an example. I live with type 1 diabetes. And over my journey, since being diagnosed when I was 30, I've used a range of different products as my preferences and needs have changed over time. So when I was pregnant, I needed a different product. So when I wasn't pregnant, when I was first diagnosed, I needed a different solution to what I use now. And so this ecosystem and this opportunity for people to gain access to the right solution for them really supports better health outcomes. And then the other thing that we do, as Kumar talked through, and Jim, is engaging with the healthcare professionals. So this is about activating people to now use these solutions. And we have our most trusted people in the community are our healthcare professionals who have touch points with the population we're trying to support and empower. And so we work in this collaboration to really think through not just which products are good, but at what point would what product be most effective and have the greatest impact. And this then really supports the healthcare professional to know which solutions to suggest or recommend to their population. And that's all about activation. And it's this continuous cycle. So just a little bit about ORCHA. So this project, we're so excited. It's so visionary, Jim, and you know that I'm completely wedded to this vision. I think it's the right vision. We work with about 50% of the NHS at a local level. And most organisations are looking at this as a potential vision. And what's really exciting about this collaboration is we're taking steps forward to make that vision a reality. We also work internationally, so we don't just work in this country, we work in 11 other countries. And that's also really important as we support people who have different needs and preferences. The world is a very small place now. I know that we don't get the opportunity to travel as the same, but our communities aren't just English speaking. They're not just from an English culture. And so because we work in different countries, across multiple languages, multiple cultures, we're able to match the right product to the person who needs that product. So I'll pause there, but really great. I think this project is very exciting.
Thank you, Liz. And I think what I'm struck by from what you're saying and from what Jim said, really, that if one provider was trying to do all of this, you would never have the richness of functionality and features for citizens. You know, there's no way that Mindwave could build an ORCHA platform, for example. You know, you spent years and years building this really very specific platform. So the more we can collaborate, the richer
absolutely
products and services we get for citizens. So just to build on that, Lloyd, tell us a bit about Silver Cloud and the services that you offer and how you're part of this ecosystem. And particularly maybe talk about COVID, because obviously the COVID situation really accelerated the use of your platform in the region.
Yeah, absolutely. Thanks very much, Victoria. So Silver Cloud is a digital mental health platform that has 30 plus programs of evidence-based, internet-based cognitive behavioral therapy that really builds on what has been said before, which is to empower the person to get the right help at the right time and empower them to manage their own mental health and well-being challenges for themselves wherever possible, but also with support wherever that's required by a professional mental health service counsellor or other professional. So for us, our real mission is to get evidence-based interventions into as many hands as possible. So to be able for someone just to be able to kind of have the power of technology that available to them wherever they are, whenever.
We've lost your volume for a minute there, Lloyd, or I have at least.
Oh, I just lost my audio there. Sorry about that. So too many devices. So what I was saying is that for Silver Cloud, it's really important that we get evidence-based interventions to as many people as possible, and to kind of use technology so that the right help is available at the right time when they need it. Often people face these artificial barriers in terms of getting help. And technology is a great leveler of that, but some of those barriers still exist. So for example, to get access to Silver Cloud in some parts of the UK, people might need to be able to firstly recognize that they are suffering from a mental health issue that they want to address. Then they need to be able to go to their GP, ask for help and go through their story. Then they need to wait for a referral into a mental health service. And then they need to be kind of assessed to see whether they might be suitable for digital. And then they might be offered access to a digital program. Now, for me, those are too many barriers and too many steps for someone that wants to get help right now in order to go through. So the exciting thing with Jim's vision and being realized by the kind of the partnership here is that it should be available at the point of need. That as soon as somebody kind of feels that they are experiencing kind of challenges that they might want some help with, that it's available immediately to them. And so this is kind of why it's exciting. It breaks down some of those artificially created barriers to the right help at the right time. And being able to embed something like Silver Cloud into a service just allows that person to then own that journey and be a part of that journey. And we do need to kind of take an ecosystem approach because, as has kind of been reflected, no one has the full answer. And when we think about mental health and well-being, that's a continuum of experience from people who are kind of stressed by kind of remote working, all the way up to people who might be kind of managing more kind of long-term issues such as schizophrenia, bipolar, etc., and everything in between. And so we do need to be able to kind of have solutions that work right across the continuum, but also to kind of represent the needs of that person at the right time. As Liz so eloquently put, your needs do change over time based on kind of the challenges that you face, whether that's kind of a physical problem like diabetes or whether it's a well-being or mental health challenge. So being able to have the right solution at the right time and something to kind of track with you to be a digital constant is really important. So the partnership is really key. With regards to kind of COVID-19, it's kind of really, it's been a real moment in kind of digital solutions, and particularly in mental health. I think, you know, we've seen, if we have a look at the data from NHS Digital, the referrals into mental health services plummeted during the early days of COVID. So if we have a look at sort of March, April, May, and look at national data sets, we can kind of see referrals dropped by, in some months, up to about 57%. And that's on a national basis. On a sort of local basis, there were some areas where, due to redeployment and other challenges, they had to kind of close their doors apart from offering a digital service. So when we kind of see those referrals drop, what Silver Cloud actually found was there was a huge spike in usage. So up to about 183% in primary care mental health services, but even higher elsewhere. So we actually kind of found, when we interrogated the data recently, that almost a third of all primary care mental health appointments were delivered digitally by Silver Cloud during some months of COVID. Well, for me, that's a really kind of exciting kind of change. And that starts to kind of think about digital being almost on a par with traditional forms of intervention. And that's where I think kind of digital has a real role to play, to kind of have that parity of esteem with other forms of treatment. And of course, we need to make sure that those forms of intervention, those forms of help, are truly evidence-based, which is obviously kind of why it's absolutely kind of critical that we have a service like ORCHA available. But I think kind of COVID has been a real moment in terms of that digital transformation. And whilst things might kind of change slightly, I think those changes are here to stay.
Thank you. Thank you so much for that, Lloyd, and absolutely endorse what you've said there at the end. Okay, so we've got about 10 minutes left, and we've talked a lot about the vision, the role of partners, how we're delivering. And just to be clear, because I know we've had a few questions, we've got a public beta going live in November, so that's when people will be able to see it, but we're happy to do demos for anyone that would like to check it out in the meantime. But let's talk about some of the more challenging stuff, because there might be people on this webinar who are thinking that this is something they'd like to do in their region, and clearly this is an ambitious vision. There are a lot of challenges within it. And we had a really good question from Andrina, which was about how you make the value case and how you think about health economics. So how you think about how not only this will improve quality and access, but actually how it will make services operate more efficiently and effectively. So Jim, could you maybe just share some of the thinking that you've been doing in that regard, and particularly around how you make the case and some of the challenges that you've had to really work through?
Yeah, sure. And I suppose in terms of benefits and thinking about my finance colleagues looking for tangible financial return, it's certainly the case that just on that as a barrier to get through, if you like, that if you look at digitized appointments, for example, and digitized letters, then that of itself provides a significant financial return against any investment that is made. And although it may seem like an odd thing to start with, because we're talking about values and we're talking about almost philosophies, the hard-nosed thing is we need some way of proving a financial return in the first instance. Beyond that, the thing that in terms of service efficiencies, the thing that has come out, and you know, it's to the point really that some of that Lloyd was saying about the impact of COVID, and recognizing that having let the genie out the bottle that says not everybody has to attend a physical appointment, having said that not all consultations need to be face-to-face, then there's significant saving and efficiency in time and money. And if you look at some of the outcomes of that, and I rolled out the Attend Anywhere video consult service, for example. When we look at the outcomes there's something like 70 or 80% people put this as a preference, not just as a it was a handy alternative. This was a preference for many. And also we found that in some services, particularly in mental health, that the video consultation was preferable because people were less anxious in doing a video consultation than they were in attending through a consultation process into a clinic, because they were in their own home. And then for people, for a clinician, particularly one of our perinatal clinicians, was saying that seeing someone in their own home with their own baby and seeing what the home environment meant, they learned an awful lot, and said, even if we go back to whatever normal looks like, I might have the first appointment face-to-face, but I'd always have the subsequent one so I can see people in the context of the environment in which they live. And so there are financial, there's efficiency, and then I think for me the other benefit is that people are able to choose the access that suits them best for what it is that they want to do. And if I just stray into some of this sort of telehealth work around self-care, we actually see people saying that when they're starting to use digital technologies, that when we do the outcome scores with them, that they're feeling better, as in no other intervention than providing the appropriate digital tools is enabling them to feel better about their condition and in managing their condition. So there's a range of benefits, from the patient personal. I could go on and talk about benefits to clinicians and organisations and so on and so forth in terms of their workload and caseload and so on. But I think it's probably sufficient there to say that there's no shortage of benefits to an approach like this.
And I guess the challenge and the opportunity is to quantify those benefits and measure them and take a really rounded approach, as you say. So the benefits across the system to different stakeholders. Yeah, absolutely. Yeah, absolutely. And it is the importance of a proper benefits management approach. You have to start benefits management approach at the beginning. Yeah. Not retrospectively. Thank you. Now listen, we've only got a few minutes left, so I'm going to invite everyone just to say a few words, like a minute or two each, about knowing what you know now at this point in the project. If you were giving some advice to a region thinking about doing this where they are, what are the sorts of things they ought to be thinking about? And I'm going to invite you, Lloyd, to go first, if that's okay.
Yes, I think for me, the kind of what I know now that I would love to know then, and what I would kind of my advice would be that awareness is absolutely everything. That what we saw in terms of kind of utilization, that there was a huge spike where when kind of COVID first happened, there was lots of awareness building, there was lots of kind of promotional activities, there was lots of messaging going out there. And we saw that there was huge kind of surges in activity. If people saw it, they wanted it, they used it. But what we've kind of find is as those messages you kind of dwindle, if we don't kind of continue that awareness campaigns, if we don't make it kind of front and center, then you kind of get into a bit of a vicious cycle or a downward cycle where it's probably not going to be kind of found as much, it's not going to be used as much, and then often the danger is that you kind of point a finger at the technology when it's not a technology related issue. So I think for me, what has to go hand in hand with all of these things is that kind of awareness. How do you get this into the hands of people? How do you make sure that people continue to know it's available to them at the time they need it? Because often people will say, oh, that's not for me now. And then when they do want it, they don't know where to find it again. So for me, that's one of the kind of the key lessons here when we kind of think about kind of the lessons from kind of COVID and kind of digital transformation in general.
Thank you, Lloyd. And I think yeah, I've definitely learned that over the years, the importance of social marketing, not expecting people to come and find your app or platform, but actually getting out there, finding where people are and making it available to them there in the moment when they need it is really key. Liz, you've just got about a minute to share some.
Yeah, so I completely agree with what you've said there, Lloyd. And I think that the second thing to the awareness is once people have had their awareness raised, you then need to engage with them. There is still a nervousness around digital technologies, and we need to engage with every part of the system and stakeholder groups to ensure that people, first of all, are able to ask the questions that they may have regarding these new solutions, and then really think through how they apply it within their own work, life or practice. So obviously engaging with healthcare professionals, system leaders, engaging with populations, patient groups, and that engagement after the awareness is really important because people become aware, they might have some nervousness, and without that engagement, we then don't get a conversion. So
brilliant. Thank you. That's a really good point to build on, Lloyd's. Kumar, final word from you. What would you advise any region thinking about taking this approach?
I think the needs and expectations within a region will be vast. So my thing would be don't try to answer all of those problems. pick and choose. And if you get the right partnership going with organizations and the right team, you can start at whichever place makes sense for that region, either policy perspective or anything else. And all the other challenges can be overcome if you architect the thing and go for a, as the title of this session says, open system. So if you try to answer all the questions, all the expectations, then you'll be there designing everything for another 5 years. Life will change, digital scene will look very different. My thing would be focus, get down to what you want to do and get going. And the points that particularly Jim made around the benefits will come. And that can be demonstrated very, very quickly.
Thank you very much for that, Kumar. That's a great place to finish the webinar. Thank you so much to our panelists. Normally they'd be given a round of applause, so I'll just do a little solo one there for everybody on behalf of the audience. Thank you ever so much, everyone, for joining us, for your questions, for your contributions in the chat. If you'd like to find out any more, I've left my email, or you can contact Habitat. But enjoy the rest of your day. And I'm just looking out the window, it's a little bit rainy here, but enjoy the rest of your day and enjoy other events as part of the Leeds Digital Festival as well. So thank you very much.
Thank you.